Hey everyone, and welcome. I am absolutely thrilled you're joining us for this explainer today because we are going to dive into the literal architecture of us. You know, when we hear terms like birth defect or congenital condition, it's super easy to instantly feel a sense of fear or apprehension, right? But today, we're going to completely reframe that. We are going to look at these conditions not as anomalies to be afraid of, but as intricate, honestly fascinating variations in the human blueprint. The way our bodies develop in the womb is nothing short of miraculous. And sometimes that biological blueprint just takes a slightly different yet totally understandable path.
All right, let's dive right into this. Here's our roadmap for today. We'll start off with the blueprint of life, followed by shaping the limbs, and then the head, face, and senses. After that, we'll explore internal and abdominal development, and we'll wrap the whole thing up with the triumph of medicine.
Starting with Chapter 1, the blueprint of life, focusing on the awe-inspiring complexity of fetal development. It is genuinely mind-blowing to think about how this all works. Just a few short weeks after conception, this massive cascade of events kicks off. And just a tiny genetic shift, or even a subtle environmental influence during this really early window of pregnancy, can completely alter how a tissue or an organ forms.
So, let's get clear on what we're actually talking about. What is a congenital condition? Well, it is simply a structural change or a difference in tissue development that happens before a baby is even born. It just alters how body parts or organs form. That is literally it. By grounding ourselves in this simple definition, we can really start replacing societal stigma with pure scientific understanding. At the end of the day, we're just talking about natural variations in human development.
Okay, moving right along to Chapter 2, shaping the limbs, hands, feet, and the marvel of mobility. The process of forming our arms, legs, fingers, and toes is incredibly complex. And as you might guess, sometimes this intricate process takes a slightly different route during fetal growth. Let's look at two of the most common limb differences out there, polydactyly and syndactyly. Here's a wild fact. During normal development, our hands actually start out looking kind of like little paddles. The tissue between our developing fingers and toes is supposed to gradually disappear. But small changes in the genes controlling this process can leave an extra digit behind, which is what we call polydactyly. Or, if that separation process doesn't fully finish, the fingers or toes remain joined together, and that's syndactyly. Believe it or not, syndactyly has existed throughout all of human history. It even shows up in ancient human artwork. So these definitely aren't new mysteries. And the best part? Today, highly successful pediatric microsurgery can easily separate these digits in early childhood, meaning these kids grow up with perfectly normal hand and foot function.
Another super fascinating developmental difference is clubfoot. This happens when the bones, muscles, tendons, and ligaments develop in an unusual position inside the womb, causing the foot to twist inward and downward. Now, in a newborn, I won't lie, it can look pretty dramatic. Without treatment, a child would actually have to walk on the side or the top of their foot. But, and this is a big but, the treatment for this is hands down one of pediatric orthopedics' greatest success stories. Enter the Ponseti method. Developed back in the 20th century, this non-surgical approach is an absolute game changer. It basically completely avoids major surgery in most cases. It starts just weeks after birth, with some really gentle stretching, then it moves on to casting, and finally relies on braces. It gradually corrects the foot so beautifully that these kids grow up to run, jump, and play sports right alongside their peers. It's a phenomenal triumph of medicine.
Now, sometimes disruptions in early pregnancy, like a sudden change in blood supply or a genetic factor, can cause a limb to not fully develop. We call these limb reduction defects. This might mean a missing finger, a shorter arm, or sometimes an entirely absent limb. But the story absolutely doesn't stop there. Actually, scratch that. This is exactly where human ingenuity takes over. The opportunities for children born with these differences have been completely transformed by modern prosthetic technology and adaptive devices.
Just listen to this quote. It perfectly captures what I'm talking about. Numerous musicians, artists, surgeons, and elite athletes with congenital limb differences have demonstrated extraordinary skill despite these physical challenges. Isn't that just incredible? Advanced artificial limbs, paired with a much-needed shift in public awareness, have moved our focus completely away from disability and put it exactly where it belongs, on resilience, innovation, and astonishing human ability.
And that brings us to Chapter 3, Head, Face, and Senses, Crafting Communication and Perception. Here, we're going to look at the delicate tissues that form our face and the sensory organs that allow us to communicate and interact with the world around us.
Let's contrast a couple of specific differences in how the ear develops.
First, we have Microtia, which is where the external ear is unusually small or partially formed during that first trimester. On the flip side, we have Anotia. This is an extremely rare condition where the outer ear and the ear canal completely fail to develop. But here is the amazing part. Because the inner ear often still functions totally normally, we have incredible solutions. Specialists can wait until later in childhood and actually rebuild the outer ear using the child's own rib cartilage or even custom-made prosthetics. Add in specialized bone conduction hearing devices to ensure sound reaches the brain, and you drastically improve these children's ability to learn and communicate.
Now, let's rapidly run through 3 distinct facial and sensory developments. First up, cleft lip and palate. This is a gap where parts of the upper lip or the roof of the mouth fail to join together. With modern, multidisciplinary care, so we're talking surgeons, speech therapists, dentists all working together, the outcomes are totally transformed. Second, congenital cataracts. These are cloudy eye lenses present right at birth. While it is a leading cause of childhood blindness, it is highly treatable. Pediatric eye surgeons can just remove the cloudy lens and use artificial lenses or glasses to restore sight. And finally, Craniosynostosis. This happens when the flexible joints of a baby's skull close up too early. Craniofacial surgeons can step in and reshape the skull, which gives the rapidly growing brain the exact space it needs to develop. The common thread in all of these? Highly successful, specialized treatments that fully restore function.
Okay, let's move a bit deeper and see how this all builds as we enter Chapter 4, Internal and Abdominal Development Systems Beneath the Surface. This is an area where the invention of prenatal ultrasound has completely revolutionized modern care. I mean, we can now look at systems beneath the surface long before a baby even takes the first breath. Let's look at 3 vital internal structural conditions. Did you know congenital heart defects are actually the single most common category of birth defects worldwide? The heart forms just weeks after conception, so even tiny changes can leave openings or narrow vessels. But because we can detect this early with ultrasound, doctors can plan life-saving interventions before the baby is even born. Then we have Spina Bifida, which is where the spinal column doesn't completely close. A fascinating and actionable fact here is that adequate maternal folic acid intake significantly reduces this risk. Lastly, Hypospadias. This is one of the most common male reproductive conditions, where the urethra opens on the underside of the penis. It's routinely corrected with highly successful surgery in early childhood, leaving very little visible evidence and resulting in perfectly normal long-term outcomes.
Now, there's a really striking contrast between these 2 abdominal wall conditions. With gastroschisis, the baby's intestines develop outside the body and are directly exposed to the amniotic fluid. With omphalocele, the organs also develop outside, but they remain enclosed inside a thin protective sac. I know the appearance of both conditions at birth can be incredibly alarming for parents, but here's the reassuring part. Survival rates have improved dramatically. Thanks to neonatal intensive care and gradual surgical closure, these infants recover beautifully and grow up with healthy digestive function.
We also have something called congenital diaphragmatic hernia. So the diaphragm is the muscle that separates your chest from your abdomen. If it fails to develop completely, abdominal organs can actually migrate up into the chest cavity before birth. As you can imagine, this restricts the space available for the baby's lungs to grow, which means they are born with severe breathing difficulties. It requires immediate, intense stabilization the second they are born. But once again, thanks to unbelievable advances in ventilation techniques and surgical care, survival has skyrocketed, and so many of these patients go on to lead incredibly active, fulfilling lives.
And that perfectly sets the stage for our final chapter, the triumph of medicine shifting from fear to future. If there is one overarching narrative I want you to take away from this entire explainer, it is the miraculous ingenuity of modern pediatric medicine. We are living through a profound shift, moving away from fear and toward a bright, highly capable future.
Let's just quickly summarize the monumental impact of these medical advancements. Think about fetal surgery. Doctors can now intervene before a baby is even born, drastically improving long-term outcomes for conditions like spina bifida. Microsurgery is restoring delicate, intricate function for things like syndactyly. Advanced prosthetics are empowering literally extraordinary athletic and artistic abilities for people with limb differences. And multidisciplinary care is fundamentally transforming the outcomes for complex conditions like cleft palate. Things that were considered completely untreatable for most of human history are now routinely and remarkably successfully managed.
So I want to leave you with this final provocative thought and question. How will advancing medical technology and shifting public awareness continue to transform the lives of those born with congenital differences? We've seen exactly how far we've come, from ancient artwork depicting Syndactyly all the way to today's microsurgeries and elite prosthetic athletes. The human body is just incredibly resilient, and our capacity for innovation, it's basically boundless. I really hope this explainer sparked your curiosity and replaced any apprehension you might have had with absolute awe. Keep learning, keep questioning, and I will see you next time.